You and I know, Russ, that one of the main problems in working with our bipolar students is the issue of substance abuse. That they all are going to struggle with it in some way, either get involved with it too much or it creating discomfort in their social life. And how do you think about substance abuse in the young adult with bipolar, and what do you tell them?
Mm-hmm. Well, you're absolutely right, Andy. I do find that in my work with the bipolar students, many of them, I might even say most of them, at some point in the course of at least their early experience with the disorder, are involved in substance use, and it complicates the picture. It makes it more difficult for them to treat, and it makes them more unstable. In fact, I'd say I would observe that probably in about 70 to 80% of the students that I see. Now, I've thought about this a lot, and I've asked myself why. Why is it that with the bipolar students, more than other diagnostic sets, we see higher substance use? I think there are three reasons. Certainly, depression is a significant part of bipolar disorder. I think most folks with bipolar visit depression intermittently, and some experience it a lot. Right? Depression is painful. People feel sad, they feel blue, they feel awful, they feel lethargy, they feel lack of motivation, and sometimes depression can be very painful. And they may find that the medications they're on aren't really helping. They may find whatever other modifications they have in place to try to help themselves to feel better aren't kicking in quickly enough. And simply their tolerance of the emotional pain may reach a point where they say, I want to change this, I want to do something. Well, you know, having 3 or 4 beers or getting high or snorting cocaine or taking whatever else they may have access to, it does change it. And it may work for them transiently. You know, it may help them to feel better for an hour or 2 or 3. And while indeed it only complicates the picture, at least temporarily they feel like, I have some control over this. I can do something, right? I can take a drug and that changes the way I feel. So I think that's one of the reasons that folks use, or bipolar people use. I think another reason is that this experience of mid-range mood that is common for most of us. For the bipolar individual, they sometimes begin to miss their intensity. So let's say you have someone who's in treatment, who's been on a mood stabilizer, and they've experienced sustained stable mood for 8, 10 weeks or so, right? And maybe it's been a while since they've really been smooth. Sometimes for the bipolar individual, their intensity feels like it's an integral part of who they are, and they begin to miss it. And so they want to access it again. Well, drug use tends to kickstart that experience of intensity. So someone can drink or someone can get high or whatever as a way of accessing some of the hypomanic intense experience that they are no longer having. I'm not saying that's a good choice, but I often see that as one of the motivations behind people's choice to use. Third, I think that when we see students moving into their hypomanic mood elevation, often the experience of pleasure actually leads to a craving for more. Mm-hmm. If a little bit tastes good, then I want a lot because it'll taste better. It's kind of that simple. And so I often see that as students begin to move up in their mood and in their cognitive activation, their desires to intensify that are actually stronger, at least early in their disorder before they really clearly see that that's problematic. So I think a number of these different factors contribute to their substance use. Now, I wish you could just say that to someone and have them get it and have them go, oh, all right, I hear that this probably isn't good for me. Well, we all know that most 19, 20, 21-year-olds have heard from many different sources that using substances frequently, particularly if they're bipolar disorder, isn't good for them. That's not new information. But that doesn't mean that brings about a big change in their behavior. I think that what I observe is that for the bipolar student, they gradually discover that substance use only compounds or only complicates their experience of the disorder. If they're trying to adjust meds, and let's say the meds that they're currently taking aren't working well, and you introduce recreational drugs to that, it even renders those medications less effective. Or a psychiatrist says, well, look, let's shift you from this medication to that because this one doesn't seem to be doing the trick. Well, if you're drinking a lot or if you're getting high, you're only undermining the benefit that you're going to be able to receive from new medications. I find that as students struggle again and again, and as substance is part of that recurring struggle, then over a course of time they begin to realize this is the variable, at least this is one of the variables that makes me worse. And if they can gradually withdraw that and learn to control it and learn to substitute substances for other healthier means of recreation, they get better. Or at least their mood instability improves.